well, let's bring you more now on what came out of that briefing that has just ended. Acting Health Minister Mmamoloko Kubayi-Ngubane is saying the National Coronavirus Command Council will be meeting early tomorrow to consider further restrictions as the country grapples with the COVID-19 pandemic and the third variant. Well, Heidi Giokos was watching all of that for us, taking notes feverishly, I see, and sending questions through. Heidi, so for you, what were the important takeaways from this?
Given the fact that government possibly did not plan adequately, given the fact that we knew the Delta variant could possibly enter into the country, we knew when that ship docked in Durban, KZN, there was a high possibility that there would be a spread of the Delta variant. But the fact that the Delta variant is driving the third wave is a huge concern for government, given the fact that the symptoms are, of course, a lot different to the Beta variant that was first identified here in South Africa and was driving our second wave. And that with the Delta variant, Yuveka, we do understand that there's a high possibility that within the 14 days after testing positive for COVID-19 with the Delta variant, you will most likely be hospitalized if it's severe. If it's a severe case of COVID. We also know what's interesting, and I'm just going to, if you can just give me a moment to read what else came out that was quite alarming, was the fact that in the Western Cape, a very similar scenario has been picked up as in KZN, which is the Delta variant that is also driving a third wave in KZN. But it isn't just the Beta variant in the Western Cape, as well as an Alpha variant that has been picked up in the Western Cape, but it's also an Eta variant that has been identified and that was most prevalent in Nigeria. That was mostly found in the garden routes in the Western Cape. So there's a big concern that there are a number of variants that are in the country at the moment, but of course the Delta variant is the biggest concern for government, and this is the very unfortunate news that we have received on a Saturday.
All right, so should we take a listen now to what they actually had to say about that Delta variant?
Previously, we had communicated that the third wave peak is likely to surpass the second wave peak. Sorry, it's unlikely to surpass the second wave peak. So we were not seeing these numbers in terms of modeling, but this was based on the fact that, on the assumption that South Africa does not, in case South Africa does not get a new variant. So if we do not have a new variant, we'd see the peak of the third wave being just below second wave. Unfortunately, this is no longer the case. Our scientists, after their sequencing experiments, have discovered that we have a new variant that is prevalent in our country. This new variant is called a Delta. You know that it's not a new in terms of existing only in South Africa. It exists in other countries.
Of course, the other concerns will be around the transmissibility of this third variant, Heidi. Not so much that it actually is sort of more dangerous, but dangerous in the way that it is more transmissible than what we have seen so far.
Certainly, Yuveka, and I think this is a big concern if you just look at the alarming numbers in the country, but specifically Gauteng, that a very high number of people are testing positive. And there was a bit of confusion as to what the Premier said a few days ago, that one in three people test positive for COVID, but it's 1 in 3 that actually test that turn out to be positive with COVID-19. So this is a huge concern, and this is why there's a call for government to act as quickly as possible in terms of further possible restrictions, or their plan, Yuveka, on how they're actually going to try and stop the spread, because we've been told time and time again that we're not even in the peak of the third wave, which is a huge concern as to how they're going to try and stop the spread. But let's listen to how highly transmissible the Delta variant is.
It is really, really highly transmissible, yeah. More than all other variants, including the one in South Africa, Beta, and that's potentially why I have displaced Beta in KwaZulu-Natal, and unfortunately we expect that to also be displacing all the Beta variants in the other provinces. It is calculated that's potentially double and more transmissible than the original virus. Yeah. What's the disease severity is no clear evidence yet. Yeah, but one thing that we know is that when transmission grows very, very fast, yeah, we overwhelm our hospitals and we have extra deaths, not only from COVID, but also from other diseases, yeah. what we didn't expect, the word is that a higher risk of reinfection. Why that? Because the reduction in neutralization with serum from people infected with the Beta variant seemed to be not too highly effective against this Delta variant. So and we didn't expect that. All the previous experiments showed that very high levels of antibodies would protect it against all the other variants and lineages, and that potentially why they didn't enter in South Africa. But this one seemed to break a little bit and more likely to cause reinfection. Yeah. One good news, if there is any in that, yeah, but the main good news is that there is no evidence of vaccine escape. Potentially, these vaccines are more effective than the Beta variant and give a high level of protection against several diseases.
Okay, well, I suppose in the obvious question, Heidi, it would be around vaccines now, knowing what we know, what has been confirmed as well. And also, Helen Reese earlier also speaking about the importance of SAHPRA and what it's looking at in terms of vaccines to tackle this third variant.
Certainly, and if there's any good news and all the bad news that we've been hearing today, we do know that there is no issue around the current Pfizer vaccine that's being rolled out here, given the fact that there is a Delta variant. And we do know that evidence suggests that the Pfizer vaccine has efficacy of 88% against the Delta variant with 2 doses. We also know that government has requested SAHPRA to possibly look at whether or not we'll be getting AstraZeneca back into the country, because we do know that with the Beta variant that was not as effective, but with the Delta variant there's a high efficacy percentage rate because of that Delta variant. We also know that SAHPRA has had a number of applications for other vaccines, and we do know, if I can just get to that specific point, Sinovac, there has been an application for the Sinovac vaccine here in South Africa. That application is at an advanced stage. We know Sputnik application is also well underway, and the recent application that has come through for SAHPRA is the Sinopharm, which is from China. So if there was ever time for government to ramp up the vaccine rollout, it is now. And this is possibly one of the most crucial measures that government can fast track to make sure that people are protected as much as possible. So hopefully we'll get further clarity in the next coming days of what they actually plan to do in terms of ramping up the vaccine rollout.